Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, is really important.
Circle is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of Circle is to address the health inequities that our communities of color are facing on a daily basis.
During this pandemic, African Americans were 1.4 times more likely to get COVID-19 than white Americans, as well as nearly 4 times more likely to be hospitalized and nearly 3 times more likely to die. Hispanic people were nearly twice as likely to get COVID-19 than white Americans, over 4 times more likely to be hospitalized, and nearly 3 times more likely to die. Of the community members treated at Loyola University Medical Center, 34% of COVID-19 cases in African Americans and 44% of cases in Hispanics progressed to severe infection or death. The new COVID-19 vaccine promises to be a valuable tool in our fight to end this pandemic. Studies have shown that the vaccine provides 95% protection after 2 doses against COVID-19 in persons 16 years or older. Most patients do not have major side effects of the vaccine, only minor ones like redness, pain, and swelling at the injection site. Some patients may develop a fever or mild headache with the vaccine, but that does not mean you have been infected with COVID-19. Rather, your body is reacting to the vaccine in order to produce antibodies that will protect you from the virus. The COVID-19 vaccine is one of many ways to protect ourselves and our loved ones, and may be an important step toward returning to a normal life. Knock out COVID, get vaccinated.
Good evening, everyone, and thank you for joining us on our community conversation tonight. My name is Madeline Butler Sanchez. I am a dietitian nutritionist at the community nutrition liaison for Circle. And tonight I'm going to be talking about how to stay healthy during COVID and beyond. Before we get started, I first want to make some quick introductions and acknowledgement. I will be your host for tonight. And as I mentioned before, my name is Madeline. I am a dietitian nutritionist and Circle Community Liaison. A Circle, which stands for a COVID Equity Response Collaborative Loyola, is a team of public health, medicine, nursing, law, and social work students and professionals working in partnership with community leaders and public health officials to minimize the negative impact from COVID to vulnerable communities in suburban Cook County, particularly in West Suburban Cook County. I will lead off our conversation tonight, which will be followed by 30 minutes, questions and answers with some experts and a community liaison. Some of the team members that will be tonight with us are Dr. Nayeli Mora. She is an assistant research professor at Loyola and infectious disease epidemiologist, and Ms. Gwen Smith, and is our Circle Community Liaison, who will be offering her experience and insight on issues related to COVID and in the community. And I would like to acknowledge the Loyola Medicine COVID-19 Vaccine Community Advisory Council for their support, along with the support of the Village Press. And we also like to thank Circle members and volunteers behind the scenes working with the live broadcast, such as Evelyn and Sergio. Thank you. Tonight, I would like to spend the first 30 minutes providing you information about COVID-19 pandemics and ways to stay healthy. The final 30 minutes will be to spend answering your questions from the community, and questions that we receive at the registrations, and questions that people will be posting in our chat. Okay. So now let's focus on the pandemic as it's related to suburban Cook County, and even more specifically West Suburban Cook County. This graph that you are seeing here illustrates why the most recent data shows that West Suburban County has experienced the most number of COVID cases per capita than the other regions of suburban Cook County. The rate of total cases is very similar to that of the Chicago, except for West Suburban, that doesn't have a nearly the same level of resources as the city does to fight the pandemic. When we take a look to the top 10 leading cases of death and major health conditions for the suburban Cook County, we see that 7 of these are chronic diseases and conditions. Some of these are a heart disease, a chronic lower respiratory disease, renal disease, and diabetes, and are known to increase the risk of having or worsening the outcomes with COVID-19. Here you can see a map with a closer look. The areas highlighted in darker blues are those with the highest cases rate, and you can see how concentrated the cases are in the Proviso Township area, as well as Cicero and Berwyn. This map shows suburban Cook County communities that have been disproportionately impacted by COVID-19 and are uniquely vulnerable to barriers to COVID-19 vaccine uptake. A vulnerability is based in a combination of factors related to socio-demographic, epidemiology, occupation, and cumulative COVID burden. Again, the areas highlighted in darker blues are those with the highest level of vulnerability, and many of those areas in West Suburban Cook County. We know that our community have two main groups. One of them are a African American community. As we can see in this graph, the prevalence of some important chronic diseases within this community is higher than to their counterparts. In these same conditions that put them in higher risk for developing a worse complication to COVID-19. In all three conditions and in all age group, our community is more vulnerable. Similarly, when we look at our second main group in our community, Hispanics, they have the same risk factors and conditions that put them in higher risk for worse outcomes with COVID-19. Very similar, the data for our suburban Cook County, 7 of those 10 leading cases of death in Hispanics are chronic conditions that can represent a threat for this community. To this, we add some risk factors that can also be seen in African American community that will increase chances of having greater complications with COVID-19. These are obesity and cigarette smoking. We are focusing on our nearby communities, but as we can see in this infographic of the American College of Lifestyle Medicine, this is a problem that we can see across all United States. See, 6 of every 10 Americans have a chronic disease. Half of all Americans have cardiovascular disease, and 1 in every 3 Americans have prediabetes. 34 million people have type 2 diabetes, and 72% of Americans live with overweight or obesity. We all have heard that all of these is not good for COVID-19. As I have mentioned earlier, having this chronic disease or condition will increase your risk of having worse outcomes of COVID-19. We know that 3 of the major contributors to these diseases and conditions are poor diet, sedentary behavior, and smoking. If we tackle these 3 lifestyle causes, we can not only prevent the major chronic conditions and diseases, but we might be able to live a healthier life with lower risk of major complications with COVID. So, where do we start? I think that since the pandemic started, many have started talking about ways how to avoid COVID. So I don't think that anyone can say they have ever heard something saying this food or this supplement will help you prevent COVID or cure you from COVID, or that this food will help you with your immune system, right? So it is extremely important to know that there is no research that support any specific food or dietary supplements to treat or prevent COVID-19. We have to be very careful of the sources of information that we read around in our social media. In these continuing efforts, to protect consumers, right? The FDA, the Food and Drug Administration, has been monitoring and warning companies that offer fraudulent products which claim to help prevent, diagnose, or even cure COVID-19. Currently, the most helpful thing we have outside lifestyle changing is continuing with our protective measure, like using your mask, social distancing, and washing your hands. Okay. The vaccine for those hospitalized with the condition, the supportive treatment at the hospitals. Dietary supplements are not intended to treat, diagnose, or mitigate, prevent, or cure a disease. In some cases, dietary supplements may have unwanted effects, so especially if taken before surgery or with other dietary supplements or medicine, or if you have a certain health conditions. Okay. Untested supplement and other products that you see that work as a prevention or cure to COVID-19 that are not regulated by FDA may be dangerous for you and potentially life-threatening, so you need to be careful. We are going to talk a little bit more in detail later about this, but the Academy of Nutrition and Dietetics recommend that we obtain our vitamins and minerals mostly from its original source, such as fruits and vegetables, and with a complement of other actions in this food that we might find the nutrients that might support our immune system, a fight off infections, as well as inflammations and swelling. Those are the vitamin C, D, and mineral zinc. I will talk a little bit more later where you can find those vitamins and minerals. And on the next couple of slides, I'll tell where you can find those vitamins. So how are we doing with vaccinations in the suburban Cook? Let's first talk a little about the vaccine, as it is currently the best way to fight against COVID-19 directly now. According to CCDPH, 4 in 10 county residents have received at least one vaccine. The bar chart on the right shows that in West Suburban Cook County, only 3 in 10 residents have received at least one dose. Now that the state has moved up to vaccine everyone older than 16 years old, we need to move toward increasing these numbers of vaccine individuals in our community. So, and how we can do this? There are actually more than a few ways to get the vaccine, but in these two, most straightforward. You can register online through CCDPH, and they will assign you a spot at the nearest facility. If you don't have an email, they can call you and make the appointment. If you need any further assistance, we are also here to help you. Please call us at the number that you see in the screen, or just visit our website, okay? So now, the best way to start building a strong immune system is to have a combination of what the American College of Lifestyle Medicine called the 6 pillars of lifestyle medicine. And what is lifestyle medicine? This is an evidence-based approach to prevent, treat, or even reverse diseases by making some changes in unhealthy behavior, especially tackling eating healthy, increasing physical activity, managing stress, avoiding risky substances, improving sleep, and building a strong support system. Let's begin with my area of expertise, nutrition, and we all know how important it is to have a well-balanced nutrition. But we have to recognize this is something where many have problems. A well-balanced nutrition that includes unprocessed carbs, protein, fats, and large amounts of water will help us prevent and treat major chronic diseases, like I mentioned before. And it is important to remember that to get the most benefit, we should consume the food minimally processed. So the most intact that you can eat the food, the better. And limit the consumption of sugary drinks and processed meats. Also, it is very, very important to increase the consumption of vegetables and fruits. The first nutrient that I'm gonna talk about are carbohydrates, something that many are afraid of. But this is the main source of energy for our body. So what you need to be afraid of are those refined carbohydrates, those that you find on donuts, cakes, pastries, sugary drinks, or sugary snacks. And our main source of carbohydrates should come from whole fruits, vegetables, grains, and beans. This carbohydrate coming from whole fruits will come packed with fiber, vitamins, and minerals that are essential for optimal health. And that fiber and that vitamins will help you to decrease your diabetes risk, your cancer risk. So it's very, very important that you consume a diet high in fiber and those vitamins. For example, the recommendation of the Healthy People 2020 and My Plate and the Academy is to eat at least 1 or 2 fruits per day. You can eat your fruit, but mostly intact, please. Not the fruit that you can find in a small cup with that syrup. Because that is that had added sugar in it. So it's good that you eat it like an apple or banana or something like that, like fresh, intact, with the skin on, because the skin is where the fiber and all the nutrients are. Okay. And there are almost no limits for vegetables. In your plate, you can have a lot of vegetables, like salad, broccoli, and all the vegetables that you want to add to your plate in your 3 meals. Okay. And for the grains, the recommendations is that you eat whole grains like brown rice, oats, or quinoa, right? Those grains that are intact, high in fiber, and minimally processed, that has all the nutrients in it. If you eat, for example, a white rice, you will be missing those fibers and vitamins that you need for you to improve your health. And beans, and that are high in fiber too, and other nutrients, and are part of the carbohydrate group, but are also part of the protein group. So yes, beans have protein. They are a good source of protein. And so yeah, when most people hear the word protein, they automatically think about meat, and not we can find a protein in the quinoa, in the greens too, and of course in the beans. Okay. But plant-based sources is equal or greater value of a protein with a much higher nutrient profile. Okay, and the important thing is they are lower in dangerous fat. Okay, meat and poultry choices should be lean. Okay, lean meat like chicken breast, and if you buy a milk too, you can find your milk low in fat. And the ground beef, like around 93% lean. Okay, like pork loin too, and a skinless chicken breast. Okay, choose seafood options that are higher in beneficial fatty acids, like omega-3 fatty acids, and lower in those ocean like mercury, such as salmon, So you can, salmon is a good source of lean meat and omegas that will help you decrease your cholesterol and improve your heart health. For example, in my next slide, I will talk a little bit about fats. This is another important source of energy. And I want to mention that it's always good to choose fat that are nutrient dense, right? To avoid those saturated fat that promote heart disease. We can find those nutrients in like nuts, avocados, seeds, because those are a fat that are the omega-3s, and omega-6. And oils are important to consider too as part of a healthy dietary pattern, as they provide essential fatty acids. Commonly consumed oils include canola, corn, olive, peanut oil too, and oils are also, you can find those naturally in nuts and seeds also, and avocados. And as I mentioned before, when you consume omegas, omega-3s, omega-6s, that you can also find those in walnuts, and you decrease your total cholesterol and improve your HDL. So you will be avoiding and preventing that heart disease that you don't want. And it's always good and important to eat the rainbow, as mentioned before. To boost your immunity, to improve your immune system, eat the rainbow. For example, I have a picture here when, for example, the red, that you can find the red food in tomatoes or apples or another fruit, because the red are a heart protector. Yeah. And for example, the next are orange. You can find a orange is beta carotene and have a vitamin A that will protect your eyes. The yellows, vitamin C, will protect your immune system, as I mentioned before. And greens or leafy greens, vegetables, are all the green vegetables, will provide calcium and help you to build strong bones. And the blues are to protect your brain. The purple are to help with digestion. And brown, that doesn't show up in the picture, but I want to mention that that are the brown rice or the oats, are high in fiber, will help with your digestive system as well. And after I explain every food group, right, here I want to show you how you can build your plate, right? And you can have a half of your plate of vegetables, fruits, and everything that you want to put on all your half of your plate. And in 1/4 of your plate, you can put your proteins, your salmon, your chicken, right? And the other 1/4 of your plate, you can put your grains. And the fats, you can put some fats on top of your plate, and you will have a well-balanced, immune boost plate that will help you prevent diseases and be healthy. Okay. And here, I want to show you, for example, the nutrient-dense food choices. For example, the first column, I have a picture of a cereal. You can choose the cereal that is on top, because the cereal that is on the bottom has that sugar on top, that glaze, and you don't want that extra sugar that will promote diabetes or any condition in the future. The next is an example of a yogurt. You want to choose your yogurt low-fat, plain, and you will add the fruit to your yogurt, because if you buy the yogurt with that flavor on it, will have also that other sugar that you don't want. And the next, for example, if you buy canned beans, you want to buy the beans low in sodium, because you don't want that extra sodium to promote maybe high blood pressure in the future. The oils, is better to consume the oil in the natural form, not butter, right? And drinks, you want to avoid sodas, and the healthy option for sodas are that sparkling water that doesn't have that added sugar or chemicals on it that will promote maybe diseases in the future. And next, we have a exercise, a physical activity. And for physical activity, it is recommended, for example, for school-age children and adolescents, need at least 60 minutes of moderate to vigorous activity daily to attain the most health benefits from physical activity. Adults who are physically active are healthier, feel better, and are less likely to develop many chronic diseases than adults that are less active. For adults, regular activity can promote both immediate benefits like boost your mood, reduce your stress, improve sleep, and long-term benefits for physical activity are improve bone health and reduce risk of many diseases such as cardiovascular disease, type 2 diabetes, depression, dementia, and many types of cancer. Okay. Adults should move around all the day, and some physical activity in the day is better than none. So please keep moving through your day. And to maintain the most health benefits from physical activity, adults need at least 150 or 30 minutes of moderate to intensity aerobic activity. That means that could be 30 minutes a day for the 5 days a week, and you can be dancing in your home. You can find a YouTube video that it could be like 2 YouTube videos, like you dancing, for example, 20 minutes with a YouTube video, and then you go for a walk now that we have a great weather outside, and And adults also need like muscle strengthening activities. So, for example, when you go out for a walk, you can have some weights for you. You can be walking with your weights, or in your house, you can also find another videos or ideas that will help you to improve your muscles and your bones too. And another important one now in this pandemic that we are living, that we are in our houses, is stress reduction, right? And for stress reduction, it's very important that we connect with others, right? I know that we need to keep our distance, and it is recommended not to visit a family or friends, but we have Zoom and we have FaceTime, so we can have those Zoom meetings with our family and talk to them and see how they are doing. And another thing is get involved in activities around the area, or volunteering. I know that now there are a lot of cleaning a vaccine. You can go to volunteer to help sick people, or like any other I know that maybe in the Facebook pages or on some pages you can find some activities that you can go and volunteer. Try different ways to be relaxed in your home, like dance, meditation, put some music, the exercise that I mentioned before. Okay, you can keep also a journal. You can start writing your own journal, the things that you do in your day, the things that you wanna do tomorrow, or to-do list. Okay, take care of your spiritual needs. You can now see everybody is using the social media to stream different spiritual activities. So yeah, you can find those and be part of it. Make time to laugh. You can buy a book, read that book, and it's important to avoid caffeine or alcohol during your day just to reduce your stress. And try a breathing techniques. And I've had read that you can like deep breath and calm, and you can do this. Those are some ideas and suggestions that you can make to reduce your stress. Okay. So now for sleep health, that's another great component to improve our health. And for the lifestyle medicine it is extremely important. So a negative effect of sleep delays or interruption include a sluggishness, a low attention span, a decreased sociability, a depressed mood, decreased deep sleep, a decreased caloric burn during the day, increased hunger, and decreased feeling of fullness. So insulin resistance and decreased performance. So it's very, very, very recommended that you sleep at least 7 to 9 hours per day. Okay, so you will prevent diseases with your sleep too. And avoid risky substance. Okay, so a high intake of risky of this alcoholic beverage could promote chronic diseases in the future. So these are some recommendations that make the the Academy of Lifestyle Medicine, and yeah, you can read it and read as a reference. And what? The last one is social connection. Like I mentioned before, to reduce your stress, the first thing was to connect with others, right? So physical distancing is essential with this pandemic, and when contagious disease risks are high, right? So, but not at the expense of being isolated or lonely. So connect with friends and family, like I mentioned, via FaceTime, Zoom, texting, phone calls, and we'll have like a positive benefits, a positive emotions that will improve your immunity and will arise from even a brief virtual social connection. Okay, so as a reminders, these are the 6 recommendations to improve your immune system, to be healthy, and to be healthy, like is the title, for now during this pandemic and beyond, to prevent diseases and to be good. Okay, and as a reminder, if you want to make a change in your diet or your lifestyles, just contact a registered dietitian or a doctor that will help you to assist you in the transition and will guide you better. Okay. Thank you so much for be here and for making me present to you. And now we will have some section for questions. Okay, so I will we will be answering questions for you.
Hi, Madeline.
Hi, Dr. Silva. How are you?
I'm good. That was a good presentation. Hi, Dr. Ramora. How are you?
Good, Dr. Silva. Thank you.
And hi, Miss Gwen. How are you?
Hey, how are you?
Hi,
Great.
So nice to have you here.
Mm-hmm. So I have a question for you. Let's start asking you some questions. So is there any guidelines for proper nutrition during the actual quarantine time? So you've been exposed, now you're sitting at home. There's some, some things that you can eat while you're quarantining. So I'm giving that to Madeline.
And yes, to just to be a healthy and while we are in home, the best I think is to to have a sorry. So yeah, just to follow the guidelines that I mentioned before, just to eat healthy and to have that physical activity in your home, just to reduce the stress, to connect with others. So yeah, like doing a little bit of everything, combining everything will help you to improve your health during this pandemic and to prevent diseases and be healthy in the future.
Okay, so nothing specific per se, but sort of keep healthy behaviors.
Exactly.
Sorry, go ahead, Maura.
Yes, so I think that as Madeline exposed that this picture, beautiful picture about my plate, right? We have divided in four your plate. You got your proteins, your vegetables, your fruits, and your grains. That's a great way to figure out ourselves each meal and keep us healthy. I think that was a great example, Madeline. Thank you.
Exactly. Yeah, there's nothing like a specific. Not it's like a combination of eating healthy and your physical activity.
We have another one here. Can I get COVID from food? Is fresh produce safe to eat? At least during this time now. Go ahead, Madeline. Mm-hmm.
Yeah, there's no a research. There's no evidence that we can get COVID from food. And we can eat fresh produce, but it is very important that when we come home from the grocery store, we wash everything. We wash the vegetables, we wash everything with water, and we wash our hands and before and after, and we cook everything at the proper temperatures. And so, but yeah, that's the great thing that we can do for now, but there's no evidence that we can get COVID.
Okay, this is good. Another question is, can COVID cause malnutrition? Go ahead, Madeline.
Yeah, so all depends where the patient is. For example, if the patient is at home, it can get some malnourished because of problems breathing, loss of appetite, and yeah, that will increase the risk of being malnourished. But my recommendations is like the patients can eat like nutrient dense food, like those healthy fats that I mentioned before, nuts, avocados, like food that are higher in calories, and that will prevent weight loss and will keep the patient healthy for the time that is quarantine.
Okay, thank you. And actually, I was going to ask you about that. Ms. Gwen and I were talking earlier, and we're talking about nuts. So what kind of nuts are some better than others? Are there some that you recommend over others?
So the best nuts that is higher in omega-3s are walnuts. Yeah, the walnuts are like the best of the nuts, but all of them are healthy and provide with healthy fats and some nutrients. Like the other is the Brazil nut. Is another that I've read in some research that if you eat Brazil nuts, for example, once per week, you will improve your high blood pressure and improve your risk of heart disease. So yeah.
That's good.
Do you have any other questions about that, Ms. Quinn?
No, that's very good to know. I'm glad you brought that up. I'm very good to know.
Add it to in top of your salads, and so yeah, or as a snack, if you are eating an apple or banana, you can like grab a bunch of nuts, like for example, like in the palm of your hand, just to be like mindful of portion sizes, and yeah, have that healthy fat.
Okay, great.
I use nuts a lot of times for my snack.
Oh yeah,
I just get a handful of nuts and eat them. And
awesome.
Oh, Ms. Gwen, I think you wanted to ask this particular question. Do you want to ask this question about spices?
Oh, what did I? What spices do you actually recommend, and why is salt not recommended?
Okay, that is a really great question. Spices that I mostly recommend are like all of them, but mostly in but the garlic, paprika, but the orange, the turmeric, that is anti-inflammatory.
Oh, yeah,
An anti-inflammatory spice that is well recommended that you can add turmeric to a smoothies or your rice. So it's an anti-inflammatory one, and paprika, garlic, onion. Salt it is recommended, but in a small amount. But for example, the salt that you add, for example, when you are cooking and you are, for example, making a rice, you can add a little bit of salt to enhance the flavors of your food. But you need to be aware, like I mentioned in the graphic before, when you buy a thin can, it's recommended that you buy them like low in sodium or wash your beans, because you don't want that extra sodium from canned food or from a package, for example, chips. All that salt is the one that you need to be aware of. But you can add some to your food to enhance the flavor or to even preserve your food. For example, also when you are making a guacamole, you can add a little bit of salt to improve enhance the flavor and to improve the shelf life of the.
I have a question to add to that, Natalie. My question is reading labels, because you're talking about salt and you're talking about this and that. Is it important that you read labels? I know that a lot of people, especially I imagine in the African American community, I'm not sure if it's in other, but we don't read labels. How important is that?
So that is another great question, because label are good to read and very important to read, because I'll keep the example of the baked the canned beans, and because if you like grab the can of beans and you buy it when you go to your house, that this is high in sodium, or this contains this or that. So it is good to read in the front, low in sodium. Okay, I'll go to the back and I see, okay, so the sodium is, for example, the third ingredient. Okay, so it doesn't have that much sodium, because the ingredients are listed by weight. For example, the first ingredient that you will see is the major ingredient that is in the packaged food. For example, if you buy those fruits that I mentioned that are canned and have the syrup in it, if you see like sugar and if they're listed as the first ingredient, and then you read like the grape or something else, okay, so this is not good for me because the first ingredient is sugar, so this must contain a lot of sugar. So maybe I'll eat the grape or the fruit like fresh.
I have one more question to add to this. What's better for you, fresh, frozen, or canned?
Okay, so that is a great question. So all depends, because everything have a different shelf life. For example, you can buy all three of them, but you can eat your fresh produce first, cook that first, but have your frozen fruits and vegetables when that fresh produce you run out of that and you don't have time to go to grocery shopping, and you want to add that frozen vegetables or fruits to a salad or to a soup or or rice, you have that in your fridge so you can eat it. And frozen fruits and vegetables are good because they are frozen at the time they pick the fruit or vegetables at the farmer's market. So yeah, those are fresh and good to eat, and can is good, but we always need to watch that added sugar or sodium to it.
Those are good questions. Thank you. Let me see, what else do we have? So do you happen to know, Madeline, what is happening with food distributions in the food deserts during COVID? Has the food situation gotten better, worse, the same during the time of COVID?
I know, for example, last year, for example, VeggieRx, I was at VeggieRx, and the food distributions we tried to be accessible for the community. For example, in Maywood, to be there for the community, and it was accessible during that time. And for now, I've seen the research that I'm doing to create the resources. I'm seeing different places that are distributing food in boxes and are helping people too.
What have you heard, Ms. Gwen, about food access right now during the time of COVID?
During the time of COVID, I've heard of, especially within our neighborhoods here, it's been a lot of food distribution, more than we've ever seen before. So the food is, I think, because of the farmers and all of that are not getting the business that they normally do, they have been sending those foods to the neighborhoods or whatever. I see them 2-3 times a week throughout all the neighborhoods around. So I think that food is getting, I think this is an example of what we should be moving to, because we've done it during the COVID. So that means we can do it.
That's absolutely right. I completely agree with you. Thank you. So why do we still have to wash hands, social distance, and wear masks, even though we have been vaccinated? So I'm going to give this to Dr. Mora.
Sure, thank you. So just let's think about vaccination like another layer of protection, right? So I keep coming to this example of the Swiss cheese, that each one is going to give us a level of protection in different ways. So a face mask, and not everybody's vaccinated too. And even though we're vaccinated, we do not know for the new strains, right? We do not, there's the kids, they're not vaccinated yet. So we don't know if we're carriers per se. So yes, we still need to wash our hands, and not just for COVID, right? We are so many diseases. It could be the flu, it could be a diarrheal disease. We always need to wash our hands. It's the most important, I think, preventive measure, public health worldwide. So we have accessible water and soap. Let's just wash our hands frequently. Wear the face mask because we know it's an airborne disease, right? And we need to still use it for the reasons I said, and get vaccinated as well.
Thank you. So someone said, I felt sick and tested positive for COVID 2 weeks ago, and isolated for 10 days. So that's great. When is this person eligible for the vaccine?
Take it. Okay. So it's been said that after you test positive, right, from COVID, you need to wait 90 days for vaccinating. So that's about 3 months. That's the standard, the CDC guidelines.
Oh, I didn't know that. And then this is whether you do feel sick. What if you're asymptomatic, Dr. Mora, and you test positive? You still have to wait the 90 days?
Absolutely, yeah. You're still positive because you did have the disease. So symptoms is different from being infected or not, right? So we can manifest symptoms and feel very sick or not very sick. However, we still have the infection. Therefore, we need to wait that period of time, 3 months.
So someone reports they gave me the Johnson & Johnson vaccine 3 weeks ago. Am I still at risk for problems from the vaccine? So this person's concerned, probably what they've been hearing.
Yeah, absolutely. So these 6 cases that were announced, right, about among millions of distribution of vaccine, they seem that having appeared between 12 in the second week and the third week, right? So that's the average. I wouldn't say that is you out of the range, right? I mean the period, but you still have, you want to be aware of your body all the time. So if you have these horrible headaches, or you have like pain in your limbs or your legs or your chest, or difficulty to breathe in, go and look for medical assistance. Okay, so it's not necessary that you're gonna have a complication, but you need to get seen. What is that? Is what I mean. I would say like 3 weeks. Most likely, you are not in risk.
Okay, great. So just keep an eye on that and go to your doctor.
Correct.
Okay, great. Another question is, should the people of the faith community take the vaccine or rely on their faith and prayer? So I'm going to give this one to Miss Gwen.
My faith recommendation is practicing good hygienes with social distance, with faith, along with the vaccine, will get you back in the church where we can all fellowship together. Right now, we're not fellowshipping together because we're not all vaccine. We're all exposed to everything. But if we use faith, you never should get rid of your faith. But the faith, along with that vaccine, will get you back to fellowshipping together.
Yes, and to doing lots of things together, right?
Yeah.
Hopefully in the near future. Great. Do we have any? Okay. So what are some of the short-term and long-term consequences if I get the vaccine? Dr. Mora?
Sure. Well, let's start from local for the short term. So when you get the injection, which is intramuscular, meaning and they do it in the arm, either arm. So you're going to have some pain right in the site of injection, like any other vaccine. If you have had the flu shot, it just kind of feels the same. Some people will have soreness for a couple of days and redness around that, and even some rash. That's kind of the most frequent ones. Therefore, then there is said that the second shot, right, when you have your second dose for those vaccines, Moderna and Pfizer, there is some likelihood, some even 20-30% of the people will manifest some kind of feeling bad. I will not say illness, but some headache, some fatigue, some maybe chills. That's very frequent, fever inclusively. And you just feel like you're kind of sick and you have like a big cold and you just want to be in bed and just lay low. But this will go away between 24 hours, 48 hours, which is like a couple of days, and with a couple of analgesics and mostly paracetamol, acetaminophen, and we're good. Those are the most frequent.
Well, I had a question about you that came up. So do you recommend taking like, acetaminophen or something before the shot or after the shot?
Yeah, if you don't feel nothing, don't take anything. So it's not recommended actually that you take any anti-inflammatory because you are interfering with the immune response. So meaning that you're not gonna build up your the immunity or the antibodies that we're looking for when you get vaccinated. However, you feel like all these symptoms that I just talked about you and you cannot bear them, just take something. But if you don't feel anything, don't take it. So it's not recommended to take it before.
Thank you. Ms. Gwen, actually, I was going to ask you something. We were listening to to Madeline's presentation, or somebody had a question about what exactly is rigorous or vigorous physical activity? Could you define that a little bit? Because you defined moderate physical activity, right? What would vigorous physical activity be?
Moderate physical activity will be like exactly like walking, like dancing, like the exercise that I mentioned before. Vigorous physical activity is that physical activity that is intense. That is more intense. That runners that goes marathon runners, for example, swimming. Those sports that needs like longer or the quickly.
Okay, thank you. And I think we have time for one more question.
Exactly.
Oh, Dr. Morrow, do you know when the Johnson & Johnson vaccine may become available?
Oh, we don't know yet. I mean, I just hear in the news today that we're still waiting for Friday. That's the day tomorrow for the examination. They review all this week, but most likely this February, and maybe next week we have the news that. Well, I guess by the end of the day tomorrow we have the news what's going to happen, but most likely we'll come back. In Europe, they actually went ahead and start distributing the vaccine. So we don't know if we're going to follow the same example here in the FDA, but we'll keep tuned for next week. We'll let you know.
Yes, thank you. And with that note, yes, thank you everybody for being here. Really appreciate it. And we'll remind everybody we'll be back again next week. But we're going to do this in Spanish. Yep, en español. Hasta luego.
Sí.
Buenas noches.
Buenas noches.
Good night.
Good night. Bye.
Okay.
So yeah, and I want to add also that you can share this with any family, friends, social media, or anything that might be interesting in here, how they can improve the health during this time of COVID and beyond. Have a good night, everybody, and take care.
Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Austin Public Health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, was really important.
Circle is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of Circle is to address the health inequities that our communities of color are facing on a daily basis.